I'm going to introduce this panel within the context of the focus of the panel, which is the state and federal policies as they relate to the report. And we're very, very fortunate to have a group that brings the perspectives that we need to the conversation. So it is both research, it's policy and practice. And all of those things really have to work together to make sure that the recommendations are fully implemented. So on the very end, we have Dr. LaDonna Pavetti, who's the Vice President for Family Income Support Policy at the Center for Budget and Policy Priorities. Prior to her work here, she's done extensive work on the same issues that are addressed in the report at everything from Mathematica as a researcher also, and all the way to working as a social worker in DC and in Chicago. So she really brings the full gamut of understanding of what happens as it relates to these policies. We also have with us Ms. B.J. Walker, who served as a child welfare director in Georgia and in Illinois, but has also worked extensively in her career across Health and Human Services with a specific focus on cash income programs, on TANF, on food stamps. So she brings the expertise and perspective of the person who's actually delivering the programs that we're talking about. And then we have my friend and co-worker here in DC, Bruce Leslie, who's the president of First Focus. And First Focus has extensively focused on all of the issues that we've been talking about in the report. And in addition to that, he brings congressional experience, having worked in the Senate, and worked in other policy perspectives also at the state level. So we have, through him, the state level perspective. So we're really fortunate to have all these perspectives on this, on the various issues that were talked about. And you'll see a lot of connections to the prior panel too, I hope, as we go forward. So, Dr. Pavetti, you want to start?
No, we're starting with Bruce.
Oh, Bruce, you,
okay.
Bruce,
I'll
you want to start? Go.
All right, absolutely. Well, thank you all very much, and thank you, Brookings, for hosting this event, and Ron, for your service on this issue for a long period of time, and all the panel members for all their hard work. Just want to tell a little backstory. This all began with we had meetings on the Hill with Congresswoman Barbara Lee and Congresswoman Lucille Roybal-Allard, both members, California members, talking about this issue about child poverty and what we could do and what was the evidence. And they both serve on the Appropriations Committee, and so we talked about how the National Academy of Sciences has this immense credibility factor and how we really need to bring attention, but also credibility and bipartisan approaches to solving this issue. And so they started working with Chairman Tom Cole, Republican from Oklahoma, on an amendment to sort of get this started. So this is kind of how this all came about. And there was funding in the appropriations bills that they put in FY 2016 and 2017. So here we are in 2019, and all the great work that the panel then did. Something else to know is that a bunch of groups came together to really look at the evidence from other countries. And so some of the work from Barbara Waldfogel and others about how the UK successfully cut the child poverty rate in half. And so a bunch of organizations came together to create Child Poverty Action Group USA, which is built on the examples of advocacy groups in other countries, particularly the UK. And so the idea around that is to set a national child poverty target to cut child poverty in half in 10 years, which was basically what the committee then adopted, but also to eliminate child poverty over a period of 20 years. Something to note that's going on that's real exciting is that there's state campaigns going around to cut child poverty as well. So there's this federal effort, but then also in the states, there's in California, there's a huge effort to cut child poverty in half. In Wisconsin, Maine, Vermont, but then also at the local level, there's been a huge initiative going on in Cincinnati for some time, and now there's a new initiative in Dallas, and then some other places. I know that, for example, in College Station, Texas. So you think a very conservative place. Texas A&M University is there. They also have adopted the idea at the city level to cut child poverty. So some really exciting efforts going on to achieve this. I wanted to tell a little bit about some of the policy implications to us from this report and some major takeaways we found. So first of all, which is that money does matter. And so making these investments in our future and our children can have a significant impact. And so, as the report found, and it's very doable. It's important to note that people talk about paying for this. I think a very important point to is the cost to society aspect that was identified in the report of the cost of between $800 billion and $1.1 trillion annually of child poverty. And so the importance of addressing that, but also even thinking about at the federal level, the children's budget, the share of spending on children in the federal budget has been declining for some time now. And the only ways that you see basically even a maintenance of that share of spending is when Congress makes a significant effort to do something about it. So the child tax credit at one point, the children's health insurance program. And so it's time to make these investments. The share of spending for kids, in our estimate, will now drop below 8% soon. And so we believe there's legislation to adopt some of these ideas on moving the child tax credit to a child allowance. There's the American Family Act by Senators Bennett and Brown, and then there's also the Working Families Tax Relief Act by Senators Brown and Bennett. And then also I'll note this is bipartisan. In the tax bill last year, Senators Rubio and Lee offered amendments to improve the child tax credit. There was votes on both the Rubio-Lee approach and the Brown-Bennett approaches. They did not work together, unfortunately. So there was both amendments. If you look at there were 68 senators who supported expanding the child tax credit significantly, and it failed, despite the fact that 68 senators voted for it. Then last, just real quickly, the other things I think are really important that the report highlights is that it does the implications beyond poverty. So it also improves child health, child nutrition, education. We certainly know of the importance of this effect on child welfare programs, the importance of income transfer programs, that they have the biggest impact. And then the very last takeaway we would have is that for the longer term, and I think that there's a lot of discussion about that, is that the importance of making investments in things like healthcare, early childhood and education programs for the long term. So both sort of the short term and long term implications of this report. So with that, sorry, I went over 5 minutes.
Yes, okay.
All right, I'm going to try not to, but I want to say first that I've delivered programs at the state level in both Republican and Democratic contexts. So I look at this through a lens that takes into account that no matter the political party, we ought to be able to do something about poor people and the circumstances that they find themselves living in. The report brings a lot of good things to light in terms of how you think about these programs. And so I chose to think about this not so much in terms of the actual recommendations, but what it made me think about was we need to widen the lens through which we look at child poverty. When I finished, I had all of these things about, can we widen this a bit? Because these programs are basically an expansion of things or thinking we currently have. So what's missing? And I think in government, we tend to get focused on what and how to the point of neglecting who are these people and why are they poor. And I would like to spend some time on that with my time today. I think that we should consider that poverty is more an adaptive problem than it is a technical problem, and it's more a people problem than a program and service problem. And what do I mean about that? I think that we need to think about how people see themselves, how they think and behave, and not just what they get and how we get it to them. That's been the prevailing business model, the way we've been delivering these programs for a long, long time, and we're still standing here talking about needing to cut poverty by 50%. I'll make a couple of quick points, I hope. One, I think there needs to be, even if you delivered some of these packages from the bottom to the top, the feds and the states don't see this stuff the same way. At the state level, we see these people face to face in the context of their poverty, but the way the feds deliver them to us is through narrow program silos with regulations that are highly administrative and inflexible. And we're trying to solve a multidimensional problem housed in families and adults, and we're trying to deliver them through 1,000 doors. We worry about the wrong things, therefore. Did we get the right benefit to the right person at the right time in the right amount? And while that delivery does matter, it doesn't keep people from being poor. And we spend a lot of money making the delivery. And so what happens at the state level is we find ourselves struggling with enduring problems related to poverty, mostly at the deep end, in child welfare, in criminal justice, in rampant homelessness, and it shifts us into the wrong lane. I think we need to think about how do we deliver packages if we're going to deliver them in a more transformative, integrated way that doesn't cause such a burden at the state level. Secondly, we need to know who these people are. I sometimes read things and I go, they don't know who these people are. They don't know what they're struggling with. And they don't understand that poverty is in this country has become a state of mind as much as it is a material circumstance. And so when you're working at the state level, you're working with these people, and the program you're working with hasn't taken that into account. So I would suggest that poverty reduction, even if we're going to deliver new programming, needs a new business model. One, it needs to do more than deliver the benefits better. It needs to promote behavioral change for those adults who are raising children in poverty. Number two, it needs to understand and act on the critical role of relationships in helping families escape poverty. By the time these people get to the deep end, they don't have any social ties and networks to help them think about how do they integrate and act on the programs and the services we give them. And thirdly, we need to learn the lessons that Oprah Winfrey's project years ago learned in Chicago, that poor people live in social networks of other people as bad off or worse than they are. And helping them one at a time with individual or package programs only makes them more susceptible to the needs of those around them, and they spread a dollar that we give them far too thin for any of them to get out of poverty. I'll stop there because I'm at my time, but I certainly have some more things that I could say on this issue of who are these people and why are they poor and how can we deliver these programs differently in a structural way that gets to the heart of them being able to have a lever out of the poverty.
So I'm going to focus, being the last person to sort of, I have so much to say and sort of what has been said, but I want to sort of focus on three sort of my key takeaways rather report. And I want to start with, in some ways, where Greg started in his report, which is when their first task of really looking at the evidence. And I think that the fact that the report makes a statement about the impact of adequate income on kids is truly different than what we've seen in the past, and really resolving this correlational versus causation issue is really, really important. So if you don't read anything else in the report, I think you really should read that chapter that really lays out sort of that causal argument, because that link and that evidence and having this bipartisan scientific evidence behind the fact that income matters, and it matters in both directions. If you don't have enough income, it results in negative outcomes, and if you increase income, it helps to improve it. So I think that finding that income is really important and has this causal link is a key takeaway for me in that report, and believe me, I will be using it lots of different ways in the work that I do. The other, I think, is is thinking about the important role of the safety net in reducing poverty and deep poverty, and also in reducing racial disparities. So you heard Dolores talk in the first panel about how much there is this issue about racial disparities and the difference in subgroups. But one of the other things that the report points out is that the safety net is really important in helping to reduce some of those disparities, and it would be even worse if we didn't actually have the safety net to actually address some of that. And I think that has significant implications for thinking about the policy choices and the current policy environment, because we're in a current policy environment where we have lots of proposals that would really weaken the safety net. And just thinking of this week, we had floating a proposal that would change the way we sort of define poverty and how it changes the definition and changes over time. And that would reduce the number of people who actually are eligible for and able to get safety net programs, which means that we would be reaching fewer people in actually being able to use the safety net to help address some of those issues that I think, as Tim very eloquently pointed out, that the programs that just support work are not enough, and you really need the safety net to really address the needs of families who don't work enough, who are left out of the labor market because of discriminatory practices or because of background issues that really keep them from getting hired. So I think that there's so many issues in the labor market that keep some people out that we can't really rely on that alone. And I think the safety net really has to be part of this. So I think I'm in Tim's camp about, the package that really combines those. The other thing that I take away from the report is it really gave me this sense of urgency that in some ways I've always felt in my work, but really sort of made it even greater for me. And it ties back to this impact of income on children. And I think that it really is important that we recognize that whatever we do now not only affects kids today, but it also has sort of effects over the long term. So if we don't provide income to parents now to help them raise their kids, that has an impact on kids, which has a long-term trajectory. So I think that for me, that sense of urgency really suggests taking the report and being very mindful of not only what the packages are that people that were modeled in the report, but also thinking of where are the places where we can act now, where we're trying for the long term. And I sort of have three things on my radar that I think that are doable and have bipartisan support that we can move both at the federal and the state level. One is increase in housing. I think, housing is just a huge issue, and it has become a much bigger issue as both the supply is not great enough, the cost is going up so high, and it really isn't consistent with income, and there's also discrimination there. There's lots of factors. So housing is one. The other is childcare, and the report focused mainly on the child tax credit. But we also need to think about direct support for childcare, because we need to figure out how do we build the supply of childcare, and so that there really is access for childcare for people. And the third is to really think about what can we do to really change what we have done in our TANF program. It is a way to get cash assistance to families, and we really have shifted away from that, and that we really have an opportunity. It's up for reauthorization at the end of June to really say how can we use that opportunity to get more resources to families. So I'm going to stop there. I'm a little over.
So let me start with the TANF program, because it might also get back to some of the issues around the perceptions in this country about who are those people, right? So it's up for reauthorization. We were not really able to look at it carefully because of lack of research about the impact of the program, in general, and in particular on child poverty. So one of the strengths of the TANF program is its flexibility and the fact that it helps child welfare, it helps domestic violence, it helps a number of other areas. But that's also potentially one of its weaknesses. So what are the within the reauthorization, if we get it, what are the kinds of changes that you think will position TANF to be more accountable and to give us the opportunity in the next report to talk about why it's making a difference. And I think all of you have probably been thinking about that. But can I
Yeah.
start with you?
Yeah,
Okay.
so those of us who, were welfare to work warriors, we thought we had finally a powerful lever to get people out the house and get them out in the labor market and to get them to be participants and not recipients, and active, not passive. And I think it did what it was supposed to do. I think that we need to think about in the reauthorization of how do we continue to support work, because that's the lever. It proved it's a powerful lever for that. We probably could do some better things, and there's some things in the report that unintended consequences of doing that in terms of women in the labor market that we need to pay attention to. But I think it needs to stop being a flexible set of money, and it needs to go back to saying the goal was to get people out there. They're out there now. How do we use it to support those who are out there who are at the lower end? That would be from my state perspective.
So I have probably somewhat of a different perspective on it, although I do share some of BJ's perspective on it. I think one of our huge failures in TANF is how much of the money has been really sort of moved away from its original purpose of both providing cash income to families during hard economic times and for families who cannot work, and also to provide the work supports that people need. So that much of the resources in TANF don't go to families who are receiving cash assistance, and in some places there's hardly anybody receiving cash assistance. So it's really a funding stream more than it is a program now. And I think we need to reclaim those resources, and I think this report provides evidence for why that's important. There are families who really don't get cash, who need cash, and they struggle mightily. And so I think there is a need to rethink how do we get back to what we originally wanted to do, which was to both provide cash for families who needed it in times that they couldn't work, and how do we use it as a vehicle to really help people create a path to work. And the other thing I would say is I think the path to work is really different for different people, and that TANF serves a very heterogeneous group of people. Some people come on, they've just been out of a job and they just need help to get back on, but others have a huge array of issues that they're dealing with, and their path to work will be different and longer, and the program really isn't designed to really acknowledge that people are really at different places and need different things.
Yeah, so I would even have a kind of a third perspective on this, I think, and actually I think Donna would share this, is that, and certainly it's a lot of stuff that CBPP's put out over the years, is the juxtaposition of where we stand in this country about, so senior citizens have Social Security. What's the equivalent for kids? It's TANF. And so the fact it's a block grant, it has the same amount of money it had in 1996. Which means that the share of the ability of that program to even do any of these things has actually declined by 30%. So to me, it would be, to really rethink where TANF is in terms of it. It's not even a priority in the program. Child poverty reduction is not part of the priority. So I think there needs to be some infusion of funding and support to actually move the program to more of, to have more funding for states. And there's also huge inequities. And you think about when it was built on a block grant based in 1996. So states like Texas get, for example, per child get it's something like 1/10 of the money per child in Connecticut. Well, who are the kids in the kids in Texas are where a lot of the poverty is. And so there needs to be a whole even look at sort of how the funding is allocated to states. And so I think there needs to be a real substantial look at TANF, but it is endemic of where we are in federal programs. There's built-in budget inequities and unfairness to kids, where there's programs that are mandatory for senior citizens, they're block grants, not mandatory for kids. There's growth rates for senior citizens, not kids, et cetera, and consequently, the share of spending for kids is declining, and so is the share of income supports in the program. But I'm not sure that to me, it's not so much let's rebalance it, because I would argue that if you take the money out of child welfare is also underfunded, or child care. So it's all those things need better supports, and have just been declining over the years. And so TANF needs sort of some kind of refresh.
So could I just sort of just quickly add to that? I think that I agree that we need additional money in TANF, but I think if we have additional money, it needs to be constrained for what TANF's original purposes were, and really think about the core of the program. Otherwise, it will go to fill budget holes. And I think that we allowed states to really sort of abdicate their responsibility for providing services to the poorest families by the structure of TANF. And I think anything we do to fix it and change it going forward, we need to make sure we don't repeat that.
And add child poverty as a target.
But let me just add this one little brief thing. We need to be careful not to believe that there isn't a value in what we did in trying to stimulate people to go to the labor market. We left these people out the labor market. $265 a month and some food stamps and a Medicaid card does not take a child out of poverty. So if we're going to redesign the TANF program, it needs to be honest about where the start point is and where the end point is. And child poverty is about adult poverty. At the end of the day, if adults aren't poor, children aren't poor. And so we have to own the adults first, because the children come with them.
So there's a lot of interest in TANF up here. There's not a whole lot of interest on the Hill, is my sense. Mm-hmm. And so I want to use that to connect back to what Michael said about the critical importance of the messaging, the perceptions of what we need to do in this country. And I want to ask, starting with you, Bruce, this report was supported in a bipartisan way, and I'm not clear how broad the bipartisan support was, but it also survived 2 administrations. Mm-hmm. So given that view that perhaps there's going to be a lot of opportunity to move the recommendations forward, flying against that is lack of support for other specific programs that would help reduce child poverty. And I'm wondering, what are you experiencing now as the climate on the Hill for moving things forward? Number one, what's the climate? And number two, what seems to be the best strategy? Is it to do what you said, connect the dots, and make sure that we understand all of the programs and how they could help with child poverty? Or is it to come out with a whole nother recommendation that's broader and more expansive? Yeah. What's the climate, and what do you think is the best strategy to make it happen at the federal level?
Yeah, I think there's a couple of good signs. Is that one, there's a lot of interest in the report. We had a briefing on the House, and it was, people were angry because we had to turn people away. That doesn't happen, and so there's a lot of interest in this report on the Hill. As I pointed out on the tax credit side in the Senate, there was 2 votes that showed that 68 senators believe that we need to do more on the child tax credit. I think this report helps bolster the idea that there are 2 even more members of the Senate who might be interested in that. There's a lot of interest in the House. I think you'll see legislation coming out, more bills coming out on these kinds of things. So it's sort of, there's pockets of really important interest in making these investments. I think there's also a lot of conversation now about some of the structural issues around a lot of these programs in terms of how I would argue some unfairness is built into the system for children, and so to sort of tackle those kinds of things. And so I think it's a combination of the thing. I think what's really important about this report to really highlight is it's not just one thing. You can't just do one thing and cut child poverty in half. So it's got to have this combination of work supports and income transfers. And so unfortunately, that's not how Congress works. So how do we sort of make sure that we move this, these ideas in various committees forward? And so I think it's a concerted effort, but I think there's growing interest in this issue, and I think the report has played a huge role in that.
So I want to just push back a little bit.
Yeah.
So are people connecting the dots between things like changing the poverty level, pulling back on census, not supporting TANF? Are they connecting the dots back to the report?
I think that's part of the goal this year is to have that happen, and in meetings we're having, people are beginning to get that, and I think and sort of how all this fits together too as well,
Okay.
which is hard for members of Congress to do. They sit in their committee and they don't think about the impact of, I mean, this report has housing implications, health. You guys talked about this whole array of issues. So the tax code and TANF and all these things, how they all interact, I think is really key. And it's hard, but I think there's beginning to be more understanding of how the importance of these things impact kids' lives and thinking about the kid as a whole child.
So I would just sort of say that I think the report helps to provide a stronger case. And for those of us who I think do work of trying to advocate for policies to reduce poverty among kids or among families or poverty in general, I think it provides a really strong piece that allows us to really make those arguments. So I think some of the using the report will happen over time and will come not only from the committee sort of getting the report out there, but also from people using it in the work that they do.
Mm-hmm. I do think, however, and I'm not experienced with the Hill and how do you advocate at the federal level, but I know there's probably a number of governors who understand the burden of delivering complicated programs. I'll go back to my point earlier. The burden of delivering complicated programs without flexibility, and it becomes problematic. So I think whatever discussions need to go on need to take into account, is there a way for the federal government to push out an agenda around child poverty, around, I like to call it family poverty. Is there a way to push that out there in a way that I'm a governor and I'm talking to my executive team and I'm saying, okay, what do I say about this? How do I deliver this without spending more money at my level to do it?
So a lot of the success of the recommendations gets played out at the state and local levels.
Absolutely.
And one of the things that we certainly were very aware of in the report is how different things are getting played out from state to state. So Dolores talked about the differences as it relates to ethnic groups, some of which is aligned with the states too, but how do we make that connection for states of the federal work that needs to be done and how it needs to get played out at the local level, and how do you convince states of the importance of rethinking some of what they're doing in order to move it forward?
So I'm not sure. I think it depends on the state, but I think there's a lot of activity already happening in the states. And to be perfectly honest, in the time I've been doing this work, in the recent years, there's so much more possibility that I see at the state level than at the federal level. And so I think really, we have seen expansions of the EITC at the state level. We have remarkably seen TANF grant increases, which we haven't seen for years. Massachusetts just repealed the family cap, which means every family now that has an additional child will get an extra $100. So there is movement at the state. There was an extra infusion of child care dollars that really has created conversations at the state about what do we do to really make that the best investment we can. So I think there is already a lot happening at the state. That doesn't mean there can't be more happening at the state, but I sort of feel like when I sort of think about where's my time best spent right now, we certainly spend a lot of time on the federal, but there is also a huge, I think, ability to change
I happen
what's
to
happening
agree
in the
with
states.
you about the state innovation, but I want to push it to it's certain states that are innovating and certain states that are not. And when you look at everything from child welfare to health care, the disparities from state to state are pretty extensive. So how do you spread that innovation? How do you kind of connect the federal wanting to do it for all children, to the reality of, yes, there's great innovation at the state, but there's a lot of states that do, when we look at child welfare, who extended the age, the children can stay into care and all these other things, there were real inconsistencies that often link back to race and ethnicity and rural children and those types of things. How do we get at that? And can this report be a tool to do that?
I think it means that it's harder work in some states, and I think it also is the reason why we need a federal frame, and we need activity at the federal level to create that frame that reduces some of the inequity in states.
And so I think that I grew up in a nation, I thought, in my early social studies, where the federal government was a powerful force for driving who we are as a country. And it seems like we've retreated from that. I mean, the civil rights movement is a total example of it. And we seem to now have a federalism that is willing to just toss some things over the transom and call it a day without a set of values. So we go back to your messaging. One of the powerful messages we used in both Illinois and in Georgia around welfare to work was, welfare is not good enough for any child. Nobody can disagree with that. When you start to bring moral imperatives to this work, if the federal government, if we could bring a moral imperative into the federal space, I think then we create an environment where states have to operate, at least they have to stand in the face of a moral imperative and say, I do believe welfare is good enough for any child. Because, whether it's $100 or whether it's $50 or whether it's $200, the truth of the matter is when poor people get that, they still poor. I mean, meanwhile, the bar is rising. Everybody is not standing still waiting for the poor to come up. We're all rising. And so being poor is still poor. And so what do we do as a nation to really put ourselves in a place from a federal perspective and open the door at the state level for real innovation? I admire Massachusetts, but $100 is not going to do very much to pay rent that costs $800.
Well, that's $100 for an additional child, so it's $100 on top of it.
Okay, so I have 5 more?
But
I don't know what do I do with that. I'm sorry.
No,
I
no,
just
but
don't.
I think the issue is that $100 is better than nothing when you have nothing. And I don't think it's an either or. I think it's a both. I think the reality is that there are people who don't know where to start, and they need something to tide them over during the times when they can't work or they lose their jobs. And so I think that if we make it as a moral imperative, what we do is we sort of say to people when they are not able to work that they are less worthy than people who are working. And I think we need to think of it as a package and a continuum and recognize that people's circumstances and situations change, and meeting them where they are and helping them to move forward. I don't disagree that moving people to work is the right thing to do, but I think how we do that and the messages that we send are really, really important.
Really quick, Bruce, because we have to get to the audience.
Yeah, absolutely. I would say that it's important to highlight that 2/3 of all spending on kids in this country are at the state and local level. So those issues are real important, and these efforts about in the states and local areas are important about trying to adopt child poverty targets even in those communities. NACO is part of, for example, the Child Poverty Action Group. But I would also point out that the highest level of poverty in this country is actually in young kids, and so the numbers reverse. So while the bulk of spending, if 2/3 of all spending on kids is actually at the state and local level, for little kids, it's actually the reverse. Most of the spending is at the federal level. And so the importance of the federal government in terms of, particularly for young kids, but also into reducing inequities and racial inequities. If we didn't have a federal child care program, there would be no funding in child care in states like Mississippi. So it's both.
It is important. Okay, I'm sorry for taking some of your time. Can we have questions now from the audience? Yes. Your name and your question.
My name is Ann Carson, and my question is for Ms. Walker. In my kind of experience, albeit anecdotal, what you've said about poor people looking to each other in times of need and trying to stretch a dollar much too far adversely impacts the good that a lot of programs do. If, for example, somebody's 19-year-old gets pulled over and all of a sudden there's $500 bail that has to be paid, there is a call to the assembled family that might not have two sticks to rub together, but they want to get the kid out of jail. Right. So I would like to know from you how your insight that you have to treat a family and not just the children, and a neighborhood and not just an individual family, can be integrated into the cash assistance programs, which are most subject to being to that kind of what the administrator would consider diversion, but what the recipient would consider a family obligation.
So in my head, I see it, and details are details. But it's more of an individualized, integrated approach. If the state has to spend money to deliver through 1,000 programs, they don't have time and effort for real case management. They have time and effort for a variety of different doorways through which you deliver a lot of things. But I do think that we need flexibility for families to be able to make sure that we're attending to the integrated whole. So there is a case management model that allows families to be able to pull and not pull at times of need in different ways, and also understand that if you've got other family members who have needs, that some of those family members are also getting benefits. So I'm all for benefit packages, but I think we need to know that they have to come through a broader spectrum, a broader lens, and it's integrated. It isn't 500 doors, it's one door. I mean, there's details after that.
Can a mic here?
Hi, my name is Catherine, and I'm a social worker, direct services social worker who has left that to go into policy and advocacy.
Very good.
Particularly because what I saw over and over again was that bad policy up here leads to unbearable choices down here, and unworkable solutions. And I just was very curious to hear your thoughts, and I kind of wish I'd asked the earlier panel.
You're still here.
How is it possible that we think that investing $108 billion to have an $800 billion or $1.1 trillion impact? Why do we think that that's so unreasonable? And I'd love to hear your thoughts on that.
So I'll start. I think that I think that's an awesome point, and it's a, you think about the again, it sort of gets back to sort of the standards that we have. So we just passed a tax bill that was $1.7 trillion. Wasn't offset, but when we talk about any kid program, I mean, Christine and I, like, this is the bane of our existence in child welfare. We need to be making investments, but the standard is always, and how are you going to pay for it within child welfare? So to add some money for prevention, we have to take it out of something else in child welfare system. That standard is not applied in most other areas. We're about to do a huge infrastructure package and investment. It's not going to have to be offset.
Yeah, I think with my committee hat on and without, there was not a debate around the worthiness of it. There was an understanding of the politics of what we recommend. Yeah. So I don't think that there was ever a debate around the importance of making that investment. I may be wrong. They will tell me if I am, but I don't think that there was that debate. I think there was definitely an understanding of the reality of the world that we're in and how we had to manage that.
I think what's important in the report is that it provides provides this framework that says this is possible and doable. Yeah. And so I think it's sort of saying, how can you use that to make that argument that the costs of not doing it are much greater over time. And so I think there's a lot of work to do to use what's in the report, but I think the report provides the evidence to be able to really sort of make the case for why we need to be doing this and going forward.
Yeah, I agree.
One more question, I think, if I'm looking at this right. Yes. Yes. Is that right? I'm okay.
My name's Denise Jones. I guess following the first panel and then the conversation we've been having here, as we think about the packages 3 and 4 that were promoted in the first panel, and the discussion around work, that moral imperative to work, poor people get poor people jobs. Those jobs still don't get them out of poverty. They're working 2 and 3 and 4 jobs. They still don't have healthy families. That's just not enough, and I kind of want to hear that since you, or address that for a moment, if you wouldn't mind, please.
I think it's not only that they don't have enough, I think that they also, the majority of people do work. If you look at the data, it's just sort of at a point in time they may not be working, but the number of people who are in poverty or on TANF who work is really, really high. And so I think we really have to change our narrative around, one, what are the structural issues that really keep people poor? And what does that mean for what we need to do to actually support people who don't have enough income? So I think just changing the narrative that it is not about working or not working, it's about a labor market where people are in and out, and it's about stability, and it's about how do you support people when they're working and they're not earning enough to be able to support their families.
And I tend to agree that the problem is that we're not focused on who people are and why. We're focused on what and how we will deliver. I think we must focus on what and how to deliver. Absolutely. If my check is late, that's a problem. But I think we also need to know why and who in a much more specific way, that we can draw a demographic profile that we all own exists, but how do we draw that down to the ground and address it? And I go back again to work for, when I did welfare to work, it wasn't I knew people were just getting a job and that they knew how to get jobs. But what you're saying to people is you're inviting them to participate in the public way. You're inviting them to demand new things of their school. If I got a job, school, you got to do what you got to do. After school programs, I get more participatory. That's my principle around that. But then we have to design the programs at the bottom that actually follow up on that and that actually own that themselves as program delivery principles, not just principles amongst those who are receiving the program. That, I mean, I may be a little optimistic here about what I think is possible. I think that's possible if you don't have to do it through 500 different administrative regulations and loopholes.
So, I think we are out of time. I saw red on the board, so we're out of time. But I do want to thank the panel. With my committee hat on and off, I will ask you, mostly with it off, I will say to you that I hope you have the case made today that this report provides a lot of opportunity for quality advocacy on behalf of children and families, and we need it. So I will say no more. That's my child welfare hat on. But thank you all for your patience, and always thanks to the Academy for sponsoring this opportunity. So.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.